Okay, Jake, we're recording. So even if we don't have anybody here in person, it is going to go out to almost 50 of my staff members.
Okay.
So any content that you have to share, I've got a couple people on for the call.
Yeah.
So we're live, we're ready to record. So we're going to capture everything and then I'll make sure that everything gets out to everybody.
Okay.
I'll go through my talking points and then I'll probably get a couple staff that are joining as we go. And then we'll go from there. Go ahead and launch, bro.
Okay. Oh. Yeah, but we're live.
Who's on?
I've got a couple of my staff members on right now, but we're recording so I can share with everybody today as well.
Okay.
I can just do it.
Yeah.
Okay. Hey, hi everybody, this is Jacob from Pharmacy. So there's a couple updates and reminders we want to go through with you guys. So first things first, our respiratory medications. Our respiratory medications should be administered by the respiratory team whenever possible to prevent missed assessment charges. So that could be up to like 700 assessment charges that we miss. So
Dose.
Hmm.
Per dose.
I guess, yeah, per dose or altogether.
Hmm.
But so we want to try to have the respiratory team to administer those respiratory medications. Spiriva requires a special delivery method, which is housed in the respiratory department. So if respiratory is unavailable, the charge nurse may override the medication, but we just want to ensure that the respiratory is informed for assessment purposes. So we want to have the respiratory team administer the respiratory medications unless it's emergency, and then we could have the charge nurse take it out. But if the charge nurse does take it out of the Pyxis, then we'll have to inform the respiratory so they can charge and assess what needs to be done for there. For Meditech, we want to report any medication issues immediately to prevent any patient harm. So if there's anything that comes up medication-wise, it'll be best to either text or email or call us as soon as possible. You can also leave notes on the Pyxis just so we could follow up and figure out what the problem is instead of having it just being override and then we won't ever catch it. So we would rather be informed as soon as possible.
Can we engage in a brief discussion for the respiratory meds, Jake? I'm just gonna ask a couple questions.
Oh yeah, sure.
Do a little back and forth here.
Okay.
So, so as it stands, what is it exactly that's going to be restricted in the Pyxis when it comes to respiratory meds?
So any kind of inhalers,
Okay.
Anything for inhalers, anything for breathing treatments,
Okay.
anything like that.
Okay. So in the event of an emergent situation, staff is to do what in that situation?
Well, first things first, we'll just try to find someone from respiratory.
Okay.
So they can do the treatment themselves.
And if that person's not available?
And if that person's not available, then the next thing would be ask your charge nurse.
Okay. So the chargers are going to maintain access to being able to pull the respiratory meds.
Correct.
Okay. So again, guys, the key thing to understand on this is that it primarily has to do with capturing charges, right? Okay. I understand that the key thing here is right, the patient does come first. Okay. So we do want to maintain access so that you guys can still get in there and pull medications for respiratory if need be. Okay. This is in a critical scenario where, let's say it's 2 o'clock in the morning. There's one RT. They're over in the ER. They're intubating a patient. Their hands are literally full. Right. They're not going to be able to respond immediately in order to be able to get that medication pulled for the patient that's on the floor that needs it. Right. And this is emergent cases, right? This is emergent cases. So in your standard routine medication administration, so like scheduled albuterols and ipratropiums, scheduled inhalers, scheduled things like Spiriva, the goal is going to be for RT to be administering those medications.
Yes.
In the event of an emergent case, basically what we're wanting to do is if our team has to pull that medication from the Pyxis, administer it to the patient, we just want to make sure that we notify the RT department, so whoever is on for that shift, whether it's Jen or Chuck or Nicole or Heather, whichever of the RTs is working through that shift, we want to make sure that we notify them, hey, we pulled this medication for this patient, administered at this time for this purpose. So that way they can do their documentation side of it so that we can capture those charges when it comes to the respiratory meds. The goal here is not to create a disconnect between being able to administer medications emergently to patients, right? We don't want to create more of an issue here by restricting things in such a way that, you know, we lock ourselves down into a scenario where we can't do what we need to be able to do for those patients. We still want to have that access available, but in the standard play of things, we want RT to be doing those medications as much as possible. If it's emergent, you need to get it pulled and administered. We want to make sure we've got an avenue for you to do that, and then just closing that loop of communication to the RT team so that they can get their documentation of what we gave, when we gave it, who we gave it to, taken care of on the back end. So that way we can charge appropriately for those things.
Perfectly said. And then for the Meditech issues.
I don't really have any questions on that one. I think you're pretty clear.
Okay.
What else you got for us, brother?
And then the second reminder would be to minimize overrides. So we definitely want to minimize overrides for patient safety. The Board of Pharmacy does audit them. So use overrides only for stat medications, like emergency medications, that could cause serious harm if delayed. So always enter an order before removing the medication. So that goes back to what I was talking about, how if there is any issues with scanning or taking off a Pyxis, we definitely want to know right away so we can fix that problem before instead of just ignoring it.
And so the kind of the workflow for that, let's say, you know, I'm a nurse that's going to be pulling something from the Pyxis, right? I have an order in place. Okay. I go to pull that medication out of the machine and I'm having some kind of complication that's making it so I can't pull it under regular pretenses. What should I do?
From there, the best thing to do would just probably call us in the pharmacy so we could fix it right away.
Okay. What if there's not anybody here on site when that happens?
If no one's here on site, then the best thing would just to be email us or write a note for us. So when we come in the next day, we can fix it.
Okay.
So for things like that, then you would probably override if no one is here. But definitely make note of it so we can know right away so we can follow up and fix the problem.
Okay. And one thing that we will have available on our end inside of that cabinet that's just up and left of the ward clerk's position at the nurse's station, if you open that cabinet, inside you will find laminated multiple different sets of phone numbers that are basically your kind of direct lines of access in the event of needing to contact someone that's on call. So if we don't already, what we will have in there, in addition to, I believe we have the on-call pharmacist numbers listed in there. If we do not already have an email address that we can also provide for you guys to send an email to notify of whatever that issue is that you ran into. And the key here is when we're writing those emails, we want to make sure that we're as objective as possible with the content that we're sharing. So Jake's team, and that's going to be Ryan, Kay, Tasia, Jake, and Omar. They need as much information as possible to describe the situation in which you encountered it, because in some instances, the situation may be cleared up automatically within the system. It's just a matter of timing, right? You put the order in, you need the medication right now. You go to pull it, the system hasn't caught up just yet, right? And you're needing to go into that Pyxis machine, grab what you need to grab, and it's not yet listed as available for you, right? So we want to make sure that we have an avenue by which we can notify pharmacy of that issue that we ran into so they can immediately start working on it within the next day.
Perfect. And then just a few
questions.
Okay. Just a few more reminders. So for the fridge medications, we do have stickers on the medications that are in the fridge. So if you use something like Zosyn, there will be a sticker on there. And then you would remove that sticker and then put it in the binder next to the fridge. You put it in the patient's room that you used it for. So just a reminder to whenever using medications from the fridge, that you will put it in the patient's chart in the binder next to the fridge. Another thing, or the last thing, will be the narcotic counts. So on Mondays, we have the morning staff do the narcotic counts or the control counts in the Pyxis. And then Fridays, we'll have the night crew do the narcotic counts then. So just two little reminders. Do you have anything to say about those narcotic counts?
So NARC counts are on which days of the week?
So for the morning crew or the daytime crew will be Monday, and then the night crew will be on Friday.
Okay.
Mhm.
Okay. So then what we will end up doing to track our NARC counts, I will need to add something to the charge check book. That'll be basically a kind of a broken down every Monday for days, every Friday for nights. That's roughly 4 weeks a month on average. That will have sections in there for you guys to be able to document. Basically, it's just it's evidence that the check was actually performed. Naturally, we're going to have the physical evidence on the actual Pyxis machine that the check was performed. But by putting it in the charge book, which is kind of our go-to, we grab that at the beginning of shift, and we're pulling that to go through and do our checkoffs that we're doing, whether it's on the crash cart machines or the temperatures. We just have an additional section in there where we can sign off to confirm that we got the NARC count performed. And then again, just remember that when you're performing NARC counts, it's a 2-person gig, right? So you want to make sure that you have another qualified nurse or someone that's to that level in order to be able to access and perform that.
I have a question for Jake.
Go for it, sister.
Hey Jake, so how Keenan was giving a scenario, excuse me, on night, say that the medication fell off on the Pyxis and we can't pull it, instead of overriding it and waiting for an email for a response from you guys, can we just put a ×1 order it for that time being?
Yes, you can, just as long as you're communicating to us what is happening. So you don't have to wait for an email back from us, but just as long as it's documented, so we can follow up on it once we get in. Does that answer your question?
Yeah, thank you.
So there's another aspect that I ran into when I was covering charge last month, where it was brought up to me that in some instances, so we have patient profiling that's available in the Pyxis. Okay. With that patient profiling, when medications are due, they should populate on the Pyxis under, like, I think there's a tab called Due Now, right? And all of the medications that are supposed to be given at that time are going to be populating in that section. Now, what we were finding is that some medications weren't populating there. And it's one of those small little things that can have a kind of a big splash, right? Folks become very accustomed to the Pyxis working for them, right? And displaying all of the medications that are going to be due right then, so they don't forget, right? So outside of, maybe pulling your computer over and being able to actually check as you're pulling, which should be standard practice, right? But let's say you even do that and you still end up missing something because it's not populating on the Pyxis. This is the reason why they weren't populating. In the actual medication order, very similar to on our work lists, there is a big difference between Q8H and Q8HR, okay? And so on those medication orders, if you have a Q8H for that medication, it's not going to populate on the do now section of the Pyxis. The order has to be modified for it to say Q8HR or Q4QX, Q whatever time, and end with the R. So the R is what actually has pre-prescribed, baked in times within Meditech to schedule that medication at those pre-prescribed times, right? So Q4HR is going to be your 0800, 12, 16, 20, midnight, 04, back to your 08, right? And so if you're running into this where you're finding that there are medications that are not populating onto the Pyxis, more than likely that is the primary issue that's going on. Now, we're still in the process of trying to fix this on the front end. So when the order actually goes in, so that way, when the provider is selecting the time, okay, because as it stands right now, there's 2 times listed. You have your QXH and you have your QXHR, right? X being the same variable in that instance, okay? And what we're going to want to be doing is, to the best of our ability, eliminating the ones that lack the R. And this should streamline this process so that anytime any medication is put in as an order, it should populate in that prescribed time within the Pyxis. So that way, when you click that do now button, everything that that patient has due now at that time should populate for you on that screen. Naturally, anything that is a PRN medication, unless you can't have PRN scheduled, right? It's scheduled or it's PRN, one or the other, right? So your PRN meds aren't going to populate in that do now list, okay? So you're still going to want to be able to have that WOW available. So if you are going to be giving a PRN medication like a pain med or a blood pressure medication or something of that nature, you're going to want to have that computer handy to be able to connect with. Anybody have any other questions for Jake? Scenarios we want to run through? Last thing I want to say on pharmacy and medication items, we are going to have some respiratory specific medication training that's going to be coming out through the education department. And yeah, we're going to have respiratory medication, training that's going to be coming out from the education department, specifically on respiratory meds. So, anything else you got for us, Jake?
No, I think that's
All right,
great.
brother. Thank you very much.
Thank you.
You're okay with me posting your stuff on YouTube?
Yeah, of course.
Okay. All right.
So
What you got for us, Trish?
I'm just here for hand hygiene and ideas on how to make it more accurate.
Okay.
So anybody who has worked in other place, have they seen how hand hygiene? This is it is a standard that we have to monitor hand hygiene compliance.
Okay.
And because someone comes to the sink at the nurse's station, that really isn't, yes, that can be counted, but that's not the goal. The goal
Sure.
is to see, did they foam in before they walked into the room? And I know that it's difficult to see if they foamed out as they're coming out, but just because someone's coming to the sink at the nurse's station, I would prefer maybe somebody getting up from the nurse's station and wandering around once in a while just to see. But there has to be other places that do this differently.
So 2 questions I have just to kind of set some background for this. First question, just briefly to explain why is this important? Second question, can you explain what it is that we're missing out on right now that we're not meeting our goal?
We have 100%. The
Okay.
national average is 55.
Okay.
So I have to think it's probably, we're not that good.
Okay. So
And,
you're thinking our stats right now are overinflated.
oh, totally.
Okay.
And this really is a patient safety issue. There are there's clear evidence that we as healthcare providers give things to our patients, and we often give them things that we don't even know about, but may bring them back in 2 weeks, or they take it home to their family. And with the proliferation of multi-drug resistant organisms, there will come a time when we cannot treat our patients because there will not be an effective antibiotic. And pharmaceutical companies are not really committed to doing antibiotic research. So on our side, in our little corner of the world, we just need to be super careful that we're not giving our patients anything. And I am more than open to how we can improve this. I'll be honest, when I was at the bedside here, it always felt, oh, really? But you can split it up. I don't know. And if you have ideas from other places, you can let Keenan know. You can email me. I am not, I don't feel ownership for a particular way of doing this and am open to suggestions. So if you have any thoughts, please share.
So just a brief recap for everybody. Trisha's coming in. One of the things that she is doing in her infection preventionist role is tracking hand washing audits. Right now, we're currently utilizing a hand washing audit form that she presents to us on a weekly basis. It's typically handed off to either the charge nurse that's on the day that she comes through, or handed off to the ward clerk. The expectation right now is that hand washing is visualized and recorded on this hand washing tracking form. What we are wanting to do is find alternative methods by which we can make this process a little bit more both efficient and accurate, right? Accurate as to what we are actually physically seeing. I know offhand there are systems out there that integrate with tracking devices that staff can wear, and then will actually track at the hand washing device as the nurse enters and exits the room. So it's kind of an automated tracking system, but we're talking about something that could be tens of thousands of dollars. Not effective. It's not effective.
No,
It's been
already.
it's been proven as statistically not effective. So, and Trisha's just already offhand, relaying that these massive expensive systems that they've put in place haven't proven to be any more effective than in-person audits that are conducted on the floor. So the key here is just trying to drum up some different ideas. So as you're watching through, or for those that are attending right now, if there are ideas that you have when it comes to auditing hand washing at the bedside specifically is what we're going to want to be tracking. Please take an opportunity, share with us your ideas in order to increase the accuracy of the data that we're actually collecting. As Trish stated, right now, and it sounds like it's a good thing, right? We're currently scoring at 100%, right? But is that really the actual case, or is this overinflated information? Maybe our N value, so our sample size is extremely small, right? And we're only visualizing 5 hand washings per week, and we're visualizing all 5 of those taking place at the the sink at the nurse's station, because it's easy to turn around in your chair and see, okay, somebody walked up and washed their hands after they were walking some trash to the dirty utility room or something like that, right? Which, not that there's anything wrong with tracking that information and confirming that that person is following the proper practices for hand washing, as we learned in school. That is important, right? And it is good proof, but we do want our sample to be a little more diverse than just what we're capturing at that sink at the nurse's station. We want to be able to capture what is actually happening in our patient rooms when folks are in taking care of patients, right? Specifically, the scenarios I'm thinking of is like you're in helping one person go to the bathroom, something goes sideways in another patient's room. you need to bounce over there as fast as possible. You're moving a little faster than you anticipated. As you're exiting the room, you're taking your gloves off, you're throwing them into the trash can as you're walking into the other patient's room. You go to do something and you go, oh crap, let me go scrub my hands real fast, right? And so now we've already encountered multiple failure points, right? You know, you've exited the previous room without removing your gloves and sanitizing your hands. You've already now entered the other patient's room with soiled gloves on, potentially presenting whatever pathogens that first patient had into that room for that patient to be exposed to, right? And then prior to being able to, you know, sanitize your hand effectively a second time upon entering that room, you've now touched something. Maybe it's a toothbrush, maybe it's a cup on the table, right? And now that pathogen, whatever it may be, actually has a fomite that it's able to jump onto. And now there's potential for it to be exposed to that patient. You quickly remember, hey, crap, I need to go wash my hands real fast. You go do that. But unbeknownst to you, the damage has now already been done, right? And so that's kind of the scenarios that we want to be capturing, so we can figure out, hey, are there areas that we can improve on this? Is there better locations that we can put our hand sanitizing stations, whether in the hallway or in the patient's rooms? Are there different trash cans that we need to look at because they tend to fill up too fast? Is the type of glove that we're using not ideal for the conditions in which we're working with? These types of things are what we want to be able to garner out of this. So please take an opportunity, share your ideas that you have on hand washing for us. We'd appreciate it.
And what I can tell you is that for inpatient med-surg side, not and ICU as well, there actually are 36 opportunities to catch. There's 9 squares, there's a before and an after, there's days and nights. Nights not so good about filling out their form. And the ED is rarely 100%. Surgery is rarely 100%. So I just want our inpatient unit, because you will be a huge focus when surveyors come and they watch all sorts of things. They watch, did you wash your hands when you went to do somebody's blood sugar? Did you clean the machine off in between patients? Did you clean your hands? Did you wear gloves? Did you, every time you wear gloves, didn't you take them off? Do you foam in? There's just all sorts of things that they will watch. And while this is not just about doing well in survey, although of course we want to do that, it really has to do, I mean, Keenan is right. You have no idea what patient A may have, and that may not even be the reason they're here. And then you turn around and contaminate patient B's belongings. One last thing, and I'll let y'all go. So for those of you who pass trays, please open up the hand hygiene little towelette and hand it to the patient. The majority of our patients they struggle with opening things like the cereal, the milk, the condiments, and certainly the hand towelette, the hand hygiene towelette. So please make sure that you do that, because I mean, I don't know about y'all, but I wash my hands every time before I eat. And I'm not sure how always our patients wash their hands, after using the urinal, after using the bathroom, after scratching wherever they scratch. And then they turn around and eat. So that's just a personal yuck for me. So thank you for your time. Appreciate it. And I really would love to hear from y'all to see how we can improve this. Thank you. Thanks, Keenan.
Thanks, Trey.
Later.
So I'm going to try to breeze through a couple of items here within the next about 10 minutes. I want to try to make sure I keep my time limited. So a couple of things I want to cover with you guys. Some goals that we have for the summer, right? Obviously, the pressing one, we have survey prep coming up, right? And I was actually speaking with some of the staff yesterday. Misty had some excellent ideas when it comes to survey prep, right? We've already heard from Trish talking about things that survey is going to be looking for as we're going in and out of rooms. Are we cleaning things appropriately? Are we making sure that we're washing our hands appropriately? Are we making sure that, before we, go from one room to the next with the blood glucose machine, that we give it a quick wipe down with the cabbie wipe? Are we doing the same thing with our vital signs carts, right? Do we have cabbie wipes stocked on our vital signs cart available for us to use? Are we, reusing a blood pressure cuff, between multiple patients, or are we using an individual one for each patient, right? These are just some of the different small things that we may not notice on a day-to-day basis, especially as we try to, make our movements through the day more expedient, easier for us, right, to cut down on the amount of time it takes to perform many of these functions, because they can be tedious, right? But there is a proper procedure behind each of these things for good reason, right? And the surveyors are going to be looking for this stuff. So there are going to be opportunities coming up. I did get clarification yesterday during our EOC meeting that the survey window is actually not going to be opening at the beginning of April, but it'll be towards the end of April that will actually be opening and eligible to be surveyed. We also get a week advance heads up before survey is going to be making their visit. So they will be contacting us a week in advance to let us know, hey, sometime during the next week, we will be landing at your facility to perform our survey. So we will get a little bit of a heads up. Between now and then, we're going to be looking for strategies in order to improve our survey prep, right? Prepping our staff with sample questions that surveyors may ask, right? It could be things as simple as, do you know what your emergency exit strategy plan is, right? How do you get people out of the hospital in the event of a fire, right? Do you know where your gas shutoff valves are? Do you know where your fire extinguishers are? So we'll put together some sample items. There are things out there that are kind of boilerplate that I can pull off of the internet for us to utilize. This is something that we're going to be doing kind of at random with various staff members, just to prep them, get their brains moving and thinking about these things. And then, of course, also giving opportunities to train on, hey, if you don't know the answer to something, knowing the proper response on how to respond to that surveyor, and closing the loop, right? So remember, the key here isn't that these guys are going to be going around just trying to catch you with your pants down, take a picture of you like that and post it on the internet, right? This is in fact a opportunity for us to improve. And so if they do catch you with your pants down, and they take a picture, what they want to see happen is they want you to pull your pants back up, button them, make everything look presentable, come back and say, hey, I got this fixed. They hand you back the photograph and burn it, right? So it's an opportunity right then and there to make the correction, right? To get the answer that's needed to share with that surveyor, so that the loop is closed, right? What they are really looking for is that we are always constantly working on trying to make things better, that we're working to stay beholden to our policies that we have in place, that we're revising our policies where need be, that we're updating our equipment and performing training functions, and if there are things that we're not doing that we need to improve upon, that we're at least in the process of making that happen, whether it's via risk assessments or putting trainings together, things of that nature. So more to come on survey prep. From there, opportunities through the summer. Naturally, as we all know, I know that everybody is starting to get that itch, right? Of, oh my God, what the hell are we going to do come summertime? Is there going to be, no hours for me to be able to work? Do I need to start looking for a second job? Do I need to start, trying to move to another hospital? Do I need to switch to another department? There are some big things that I want to make happen this summer. We've got some awesome opportunities. We got a badass little team finally put together, right? It's taken almost 3 years of work in order to put together the team that we have right now. I've got a lot of pride in the team that I put together, and I definitely do not want to see us either waste our time during this summer, right, and not accomplish things that we have an opportunity to address, right? And I also don't want to lose any of the folks that we've worked really hard for to get trained, to get them experience, to get them competent in the department, right? So I want to keep you guys busy. And so here's some of the ideas that I have. We are going to be building a float pool. I'm going to need help with that. We're going to need to have training and cross training for people to go to other departments, learn in those areas so that they're usable in those areas. This is in its infancy. Okay, I do not have anything physically down on paper yet. I do not have a job description. I do not actually have approval to make these positions yet, but this is something that is going to take proof in the pudding in order to prove first. So that way we can put it together and be able to offer an actual float pool position. More obviously is going to come as far as the actual job description, what the expectations are, and things of that nature. But if this is something that you want to help me with, is this is something that you want to get engaged in coming this summer? If you want to cross train in other areas of the hospital, you want exposure to surgery and PACU and infusion, please come let me know. If you want exposure to ER, please come let me know. If you want exposure for ICU, please come let me know. These are areas that we can get people cross-trained so that way we can start building up a competent, very adaptable crew to function as our float pool. Okay, so this is something that's going to take a lot of time and effort to build, and I'm going to need help with just the infancy stages and being able to prop this building up. It's going to take a lot of work from the beginning, right? And a lot of that is going to be the actual individuals going and training in those other locations. Ideally, what we're going to be looking for is approximately 4 staff members, potentially 6, to be moving into these float pool positions once we get this thing propped up. And kind of the basic framework that I have for it is when there is not a call off and this person is going to be available effectively to float anywhere in the hospital at that time, they're going to be identifying pain points, working closely with the charge nurses in those different departments, indicating to them, hey, I'm available from this time to this time to come and help out. Anything that you need. If ED has a massive amount of check-ins that come in, they can go assist with triage. If we've got 6 admissions coming in all at once, they can go assist with admissions. If surgery has 4 patients coming out of surgery at the same time, they can go help with the PACU process, right? When there's downtime, they can break lunches, right, in the different areas. They can actually give people breaks, right? So that is kind of the purpose behind this. And then, of course, we're also going to have it available as a fallback so that in the event of a call off, we're not just relying and depending on utilizing pool shift in order to bring staff in to cover shortages due to call-offs, right? Unfortunately, sometimes there's more than one person calls off on a given shift, right? And so that float pool person will fill one of those spots. We would still be relying on the pool shift to fill another, but if we've got that fallback, it just gives us that much more of a security blanket in the event that people get sick, right? And people need vacation time and things of that nature, right? And folks have family members die and they don't anticipate that when it's going to happen. And so we're just trying to get ourselves better prepared in the event of those scenarios, as well as putting together a new position that can be a lot more helpful in our department as well as other departments in the hospital, right? Just trying to build out, an idea that I've had for, many years now. I'd like to see propped up and happen. So if you want to help with that, please let me know. I'd like you to get involved. I'm going to need help lifting the weights on that. So other summer opportunities. Our education department's getting propped up. And they're doing an excellent job, but she needs foot soldiers. Genesis needs help in that area. She has some amazing ideas that are coming up for Skills Fair this year. And one of those is that she's actually wanting to have individual staff members perform the actual training. So anyone that is a part of the La Paz team that is a clinical staff member that wants to teach one of the subject materials that's going to be available during Skills Week is going to be permitted to sign up. We're also looking at scheduling Skills Day this year. So each person will actually have the day that they are going to be completing their training scheduled on their calendar. This isn't going to be a, hey, I'm going to hold over after my shift, right? I've come in the night before and I'm going to hold over after my shift to go and complete this, right? It's not going to be a, hey, I have to drive down on an extra day for 4 hours to complete this training. It is straight up going to be put onto your schedule And we're looking at trying to complete this training in July, August of this year. So right in the midst of summertime. So that way we're getting that, maximizing the utility of the time that we have during summer. Some other things that I'm looking at too, I've been communicating back and forth with Genesis extensively, and she needs help. She needs people to come over that have great ideas, that have experience in different aspects of the nursing fields and want to teach a particular subject, right? Whether that is, putting together anything is going to help, right? So whether that's putting together PowerPoint slides for presentation, putting together an actual physical training, putting together some tests or quizzes to be utilized, right? Assisting with setting up some of the, actionable displays that she's put up, the one that's right across from the nurses station where she has had some pretty interesting designs of some things that she's put up in that area. So assisting with those types of things, as well as being able to bring new ideas to bear going over to that department. I was communicating with her this morning about trying to bring in a simulation dummy for us to use in that department. Obviously, it's something that's going to be expensive. I've got this idea of, and I don't know if we'll be able to pull it off this year because it's going to take a lot of work, guys, a lot of work. But I want to do something that's kind of very similar to what's called a tradeette or a training detachment. And I'm workshopping kind of the duration of time that this would take. Effectively, what it would be is anywhere from a week to 2 weeks in which you are not scheduled on the floor. You are specifically scheduled for a training detachment, you and a group of your peers. This would consist of anywhere from 4 to 6 people that would be assigned to training detachment for those 2 weeks. And the goal during that time period is you would be coming in and you would be completing training on a daily basis for approximately 2 weeks. Naturally, the goal here would be to have peers conducting this actual training. Majority of this, the goal would be to have it simulation based as much as possible and to take these groups of 4 to 6 people, effectively building them as a team, so that it's similar to, one person is the team leader and, they have five people that they're working alongside of, being able to work through scenarios that are presented to them and basically to stimulate as much as possible catastrophic things happening to a patient, right? Or throwing as many curveballs as possible, like not being able to get a transfer right away, how to handle those types of situations, just trying to simulate as much as possible bad things that can happen on any given shift so that we're trained and we're prepared for them. So if this sounds like something that you would like to be involved in going into the summer, being able to prop up, I'm going to need a lot of help. Ideally, I would be looking for anywhere from 2 to 3 people that would actually like to be training cadre heads. And effectively, this would be very much on your shoulders in order to really prop up and make this training what it should be. But it's something that I think we've been significantly lacking here at La Paz, as well as every other hospital I've worked in, for Christ's sakes. And I think we really stand to have a great opportunity to maximize the potential that we have over the summertime. It gets at least 2 weeks of guaranteed time for people where they're going to be getting at least their 36 to 40 hours for those 2 weeks, locks down that time period. We combine that with skills day training and being involved in that area, being involved in cross training to other departments, right? It starts to really take shape, right? That being worried about hours becomes less and less of a problem when we have more things that we can do with your free time when our census is lower, right? And then the goal there being that is we want to be prepped so that when wintertime comes around, we are a rock solid, lock in step, ready to go team that can handle just about anything that's thrown at us. This is all about leveling up, people. We are doing an excellent job. We have a lot of potential here, but I see an excellent opportunity for us to take this shit to the next level. So, and I want to see us be able to do that. Some kind of finishing points here. We've got incoming staff. So the apologies, I don't know, we're grinding something out there. We've got incoming staff. We're going to be fully staffed with techs as of Monday. So yes, many of those are going to be undergoing training, additional training before they are independent on the floor, but we are going to be at 14 techs total, 7 for days, 7 for nights, which is our full complement of techs based on our current staffing model. I also have additional ICU nurses for full-time that I've actually got an interview after this that we're going to be bringing in additional full-time RNs for our ICU, getting that area staffed up as well, effectively getting closer and closer to eliminating travelers completely out of our department. This is one of my goals for 2025 is to get to the point where we are no longer so significantly dependent on travelers on our team, specifically in the ICU, and being able to build that complement of 6 total ICU nurses. So we have that cross coverage for vacation time. We have that cross coverage for call-offs for illness, right? And so we have that extra coverage in the med-surg area as well when need be. Last little thing I want to kind of throw a thing out for is I's and O's. This is something that we're going to be providing some specific focus on in the coming weeks. I have noticed that many of our techs are getting better at their tracking, especially our night shift team. Bryce, just about every person on our night shift team, when I get their sheets back for their CNA handoff, they are almost always completely filled out with, in fact, running out of space in their INO documentation sections. Some folks are attaching a separate piece of paper. So I do have one of our day shift techs, Misty, that's actually looking at this. And Misty, I know you're on this call. Tina is also going to be working on this as well. I do want you guys to be coordinating on this. We can talk after the meeting to bring you guys together on making those adjustments on those forms. I want these to work for you guys. This is a form built by you for you. So, and I want it to be useful. I don't want it to be just a checkbox pain in the ass thing, right? It's designed to work in your favor so we can do a better job of capturing this information. That's all I've got. We've got 7 minutes remaining in the meeting. Anybody have anything they need to get off their chest? Any questions they have? Anything you need to share? All right, if that's the case, I'm going to call it a wrap here. This is a recording. It is 8:53 on Friday, March 21st. I will be posting this to YouTube, sharing it to everybody's emails. So please keep an eye out. Once you make it to the end of the video here, please understand, I am extremely proud of our team. We have accomplished so much in the last 2.5 years that I've been here. I've seen each of you grow into amazing step forward leaders in each of your roles. We have an opportunity to take where we've gotten to so far as a team and to level ourselves up to the next level. It means that we're going to have to work even harder than we have to get to where we are in order to make this. And basically what I want it to be is I want you guys to be able to walk around this hospital and say, we're the best department in this entire shop. And believe that, every single person on our team. I want them to truly, in their heart, believe that we are the best department at La Paz Regional Hospital. And so with that, kind of a final item that I want to share with you guys, I want a team name. I want us to pick a team name. So if you have ideas on a team name, please shoot those over to me. You can shoot them to me via text or via email. What we'll end up doing is we'll throw together basically a quick like Microsoft Forms survey, and we'll put a list of 10, 15 names on there for people to vote on. And once we've selected on a team name, I do want to roll it out. I'd like to take it a step further and kind of go a little crazy with this. I'd like to make some patches or some challenge coins or things of that nature, so that way we can have a little swag, right, that goes along with the actual med-surg ICU inpatient services department here at La Paz, so that you have something that you can literally wear with pride. Basically a way to what's called show our colors, right? Which is, basically having our own flag that is tricked out with our own design, right, of what we want on that flag, but, having it be on a patch or on a challenge coin or something like that, right? And same thing, I need ideas on that too. What kind of swag would you guys want, whether it's t-shirts or badges or what have you. I want us to be able to be distinguished from any other nurse in this hospital. And I want people to look at you and I want them to think, oh shit, med-surg nurse is coming. You know, I want you to be able to wear that with pride, because that is the pride that I have in this team. That's the pride that I hope that you guys have in this team. And I want to make sure that we continue to earn that going forward. I want this name to last. I want it to stand the test of time. And I want it to show the amount of work that we as a team, you guys, have put in over the last 2.5 years to make this team into what it is today. And to take that and be able to shoot it out of the cannon and get it that much further. So I hope you guys have a great weekend. Hopefully the content that was covered in here provokes some thought, provokes a little bit of emotion, some pride, some passion, gets those gears turning. We as a team, we need your help. This team is made up of you as individuals. Each of you has skills. We need to tap into those. I want to see this thing continue to achieve great things. Thank you. Have a good weekend.